Last night that the governor has tested positive for COVID-19. This is something that we had asked about last week. Because, just being in the media, people give us all kinds of tips, and we had heard some things Friday. At that press conference, there was a moment where the governor had coughed, and someone had to bring her a glass of water. And then in her release, she said she started experiencing symptoms on Saturday, which was the day after the press conference. So we'll just go right into the Zoom room from the Physicians Advisory Group. As always, anytime we got anything with the COVID, we really try and bring on the medical perspective. So good morning, Dr. Hoa Nguyen from the Physicians Advisory Group. Morning, Doc.
Good morning, Chris. Good morning, Sabrina.
So I got to ask, we had you scheduled for yesterday. I know you said you had an emergency situation. Did it have anything to do with the gov testing positive for COVID?
No. It's had nothing to do with the governor. Yesterday, we have a few sick patients in the clinic that need to be seen right away. So I had to run to the clinic, and yeah, it's a situation we're in, and I think that the new lockdown, the new restriction with the gathering less than 25 in the funeral. We will not see any effect until probably 2 weeks from now. So for the next 2 weeks, we will continue to see some rise in the case just because of the funeral and the gathering in the past few weeks. So we expect a little bit more case in the next 2 weeks, and hopefully it will slow down.
Hopefully, right.
Yeah, there was a question that was asked during the press conference by one of I think it was Nick Delgado, who asked the governor about, was there anything you think that you could have done right differently? And I'm wondering, what do you think? Is there anything that could have been done differently because we're seeing this surge of cases when you look back?
I think that we did everything correct the first one, but I think that a few people kind of go around the system, and they find ways to kind of get away from the quarantine and the isolation, and that's the reason why that we get the surge where we are. But we take steps to correct that. So and again, people were always going to find ways to go around it, but those loopholes have been closed already. So hopefully, like I say, and the new restriction, we will see some improvement in the next 2-3 weeks or so, but it takes some time to improve. But right now, what we ask people is that, if they feel sick, please stay at home and always use your mask. It's so important to use that mask. It prevents from spreading the virus. I saw a few of my patients yesterday, and they're very anxious, and I tell your workplace probably the safest place of them all, because every workplace requires for you to use your mask. Your risk is when you go home after work and you're exposed to the family or friends, and those little gathering, we don't use our masks, and that's where your risks are. Not at the workplace, but at home. So kind of be careful when you go home, because your friends, everyone, you really don't know where they have been in the past week or so. So just be careful and keep your distance.
Not sure what that sounds
Doc, what about the bars? So we had talked about the gathering. We saw the governor on Friday close down the bars for a couple weeks. Can you kind of go into that decision and why you think it was justified?
There's quite a few positive come out the bar, and that's something that help to make that decision. I think just the bar itself, quite a few bars didn't follow the regulation regarding capacity and the control. And I think that by doing that, we have some people in the test through our clinic that's positive in the past few days because they've been to bars. So at a certain point, they have certain regulation there to follow, and certain bar does not follow the regulation, and that resulted in the case occurred in the bar, and that's why she kind of shut it down for the next 2 to 3 weeks until things are cooling down.
Thank you for that, Doc, because there were just a lot of people talking about the decision, and we didn't really get a lot of info out of the governor when she dropped that bomb on Friday. So I thank you for that, because people were just hating on it. And we had the bar owners on yesterday, and it sounded like even they were having a hard time trying to figure out why. And like I said yesterday, our number one priority is protecting your lives. And if we have to shut down bars to do it because we've gotten positive cases since, they're not following the restrictions, then that's what we have to do. You guys can't sit there and say that, oh, we should have locked down the island. We should have locked down the island. Oh, why are we closing the bars? It just makes no sense at all. We're closing the bars because we got to do what we got to do. Look, I mean, the governor has COVID, guys.
Yeah. It's a case, we can't really name what bar and what location.
Yeah.
But I tell you that we do test people that are positive, and by history alone, they do attend some gathering at the bar. So it's some, you really have to be careful. I know a lot of restaurants.
I was gonna say, what about restaurants?
Right.
You can't tell me that. Oh, it's just the bars.
Right.
Yeah.
And that's why these bar owners are like, we feel targeted. It's just us bars. What about the restaurants?
Yeah, what do we do about the restaurants, Doc? Because we saw, how many restaurants came out and said, yeah, we had people who were positive. But was it because they weren't following the restrictions, or because they had an employee who was exposed somewhere outside of the setting?
Yeah, the restaurant, because employee outside the setting, but regarding patronage, people go out and eat, we don't see them that turn positive. It's really them certain restaurant, because employees, they go home to their family, and sometimes they can and hopefully they don't show up to work, but you don't have a breakout and people go to restaurant and turn positive, but they go eat in the restaurant. So we look at different case differently. It's not targeting the bar. It's really we look at it's not the employee at the bar that turned positive, it's the customer at the bar that turned positive, and that's the difference.
I want to, Doc, what can you tell us about the Physicians Advisory group meeting and this recommendation we're hearing about a strike force?
What we like to do is that we had to talk to public health, especially with the tracing team, that if they have in the future, it's going to happen again. That if they have a news like Father Duenas or something, that they have a team that go out to the site and basically set up a tent or find a place there at the site that to test for all the close contact for that site. Just because we see a huge amount of surge on the people that go to the tier 2 and some of the tier 3 clinic. I tell you, with your current clinic setting, with the appointment, everything, and you have 100 plus of people walk in to be tested, it's going to overwhelm the healthcare system in Guam a whole lot. All the clinics going to get burned out just because, on top of your regular patient every day, you will have lines of car that go several block back, and that's what we've seen at FHP, SDA, and AMC. So those can be handled by public health, and we're going to ask them to see if they can do a strike team somehow to kind of alleviate the congestion in the clinic. But we had to talk to a new director. We haven't had a chance to talk to them yet, but we're going to have a meeting tonight, so we're going to bring that up to public health.
Okay, and so this strike force, I guess you could say it would be nurses, lab techs, contact tracers. The idea is to have them on site within 20 minutes of public health notification, significant COVID-19 exposure. I'm just kind of reading through this.
Within 24 hours, they need to be where the breakout or the news like Father Duenas. I think that it's much better. People know where to go and what to expect, and more information should be out there. Just like the case of the fitness center, they it's really put out the time out there so people don't panic. Hey, I don't know what time I go to the gym. So as far as awareness, you need to release, is that the staff or the member or the student? It make a big difference on people when they know more information. They won't be panicking so much.
Yeah, but does public health even have enough people to do this when they can't even do community testing?
I think that there's a thought that we did enough community testing already. Now we need to do target testing. So this is as a target, you just basically concentrate in certain population. So rather than go community testing, I think we do a very good job in community testing in the past already. But it's time now that we're going to target. So target means that certain elderly population, if you have a breakout, those are target. So you just concentrate on the target testing for now.
Doc, I
think that's public health have at this point.
I want to go back to our governor. So in the release, she had said that she's experiencing moderate symptoms of COVID-19. Can you explain to our audience, obviously without getting too specific, what are moderate symptoms of COVID-19?
People have symptoms depend on the age, on that kind of stuff, but more likely it's like coughing, fever, chills, body ache. And those you can be isolated at home. The only time that you go to the hospital is if you have problem breathing. If you have shortness of breath, and that's when you go to the hospital. But most people can stay at home just because, like I said, they have fever, chills, body ache, and cough and cold. Like I said, that more likely that's what she have, and most people have. So they don't need to go to the hospital.
Right. So do you feel optimistic? I mean, I know you probably haven't examined the Gov, so I don't want you to speculate too much. But just to kind of put it out there for the people, do you feel optimistic that Gov is going to do well against COVID? I mean, because we're all praying for her.
Like most people, hopefully she will recover very well. I'm sure that they keep a very close eye on her, and at least anything else news for her. But I'm very sure that she's at home. She's currently doing well, and we all hope for the best.
What about your colleague on the Physicians Advisory Group, Dr. Michael We saw on Facebook that he has tested positive for COVID. I also reached out to Dr. Cabrera to get him on the show with you this morning, and he said that he's homesick and that he's been tested. He was tested negative as of now at this point. So is it just the exposure that you guys have as doctors, or was there something that happened with the group, or what can you tell us?
No. Dr. Mike and Dr. Fiscal Cabrera didn't attend the meeting, the last one on Thursday, because they feel like they are not feeling well. So we all know that when we don't feel well, that we don't attend the meeting, and we don't attend to our patient. So they isolate themselves at home, and they do the repeat test, make sure they're negative. Unfortunately, Dr. Mike turned positive yesterday. So he's isolated at home, right. And that's a risk all the healthcare providers, the experience every day. Because we're sitting across a sick patient multiple times during the day, and you always take a risk. The healthcare worker, the nursing staff, the MA, the doc. We all take a risk, but like I said, that's we use our PPE as much as we can, but they own at risk.
Well, speaking of risks, the CDC, they issued that travel warning, level 3 for Guam, that we're a high risk for COVID-19. What is your reaction to that?
Yeah, I'm not quite sure what they're coming from, but all the Guam and the American Samoa and Palau, even they have 0 case. They group everyone in one level, and we don't agree with that. I don't know what they're looking for. they might look at not just number of positive case that you have on the island, or they might look at your ability to respond or take care of the patient in the hospital
Right.
and the ICU and stuff. They probably look at multiple reasons, and the governor tried to find out, hey, what reason you base this on to put Guam and everyone on level 3, and we wait for the answer to see what they think about.
Right.
You know, so right now is like I said, it doesn't make sense to put American Samoa and allow on level 3. They have 0 case. Like I said, it might be that the CDC might look at the hospital and they might look at other area. So we just have to see what the answer is before we start yelling at them.
Yeah, I just, Doc, I mean, it's kind of interesting that on the one side, I mean, even as recently as Friday, we had the governor telling us how serious we have to take this, which, of course, we do. But then when the CDC comes out and says, hey, take this serious, all of a sudden we're like, no, we're not. We're cool. We're not a hot zone. You know what I'm saying? I mean, it's just that I kind of see a contradiction there that I can't really reconcile in my mind.
And I'm reading the CDC and for Samoa, and it does put them on a level 3. But it also says Samoa has not reported data on COVID-19 to the WHO. So their risk is Samoa is unknown, where for Guam it says the risk is high. And I could go through and look at the other places, you know,
I mean, if
Solomon
you read
Islands.
the advisory, it makes sense to me. I mean, I live on Guam. I feel like, we're...
Same thing for Solomon Islands. It's unknown. They've not reported data to CDC.
Yeah, it's not just a case. I think they look at other criteria regarding, you know, your hospital, your ability to... it's not the ability to contain. It's the ability to take care of ICU patient, all that kind of stuff, you know. So, like I said, we wait until the answer to see what the justification is before we start asking. You know, they might look a different way, but we know that we are somewhat a lot safer than Los Angeles or Florida somewhere. But, you know, I think the ability to respond to like ICU intensive care, something like that, a lot better than we do, just because, you know, we have limited capacity.
Right, and that was part of what was listed in the advisory. They had a whole thing in there about just the healthcare facilities' ability to respond.
It's almost as though we shouldn't tell anything to the CDC, and then it would be unknown.
Right.
And I don't think the border they care right now, because everyone trying to protect the border this time, so there's no traveling much at this point.
Yeah.
Right, and I think part of it was just like, you know, the governor had to clap back. You know, I mean, anytime someone, it was almost like people on Guam wear grass skirts. I mean, you got to clap back. You got to kind of stick up for the island. So I get why she wrote it, but just to me, in my mind, it's like, you can't tell us here how serious it is, and we've all got to hunker down because we are in that second surge that you guys all warned us about. But you can't tell us that and then go tell the CDC that, oh, everything's fine. Didn't you hear? We think we did a great job.
Yeah, I mean, it says, if you get sick in Guam and need medical care, resources may be limited.
Which is, I mean, it's accurate, right?
That's accurate. Yeah, we do a thin line, but we do very good what we do, but we still have limitation.
Right. Doc, you know, I read a Facebook post on one of my feeds yesterday talking about how the clinic, someone was trying to get into a clinic to get tested, and they were just saying that they went down the line and called all the clinics, and they were just full. Are we seeing that at the clinic level, Doc? Are you guys seeing a lot of patients coming in? And if so, what are they coming in for?
Yeah, I tell you, we have a lot of people coming in for testing out. You know, at 7 days, we have a lot of people that come in to get tested because they have close contact with either the funeral, father doing this, at the restaurant, at the gathering. So, like I say, typically we have anywhere from 50 to 150 patients just drive up and request to be tested. So yes, it's right now for the next 2 weeks or so, most of the clinic will be very busy to do the testing beside their own appointment. So I think every clinic try to do the adjustment to their schedule, so that way they can accommodate them. Regarding for, I can't speak for the clinic for AMC, we try to adjust a schedule that we can accommodate on the 6th visit, because we want to catch as much as possible any patient that a potential have the virus. So that's the most important thing right now, besides your chronic care management, is that we try to accommodate on the 6th visit, because we don't want to miss anyone to walk around with the virus.
Doc, how is your staff doing, though? Because I think like a lot of us, and that probably worse for you guys being on the front lines, this thing is just not ending. And, you know, to have the mental stamina, and I'm thinking for us, every day, come in, be the sun, you know, face the world. I mean, it's hard, but I can't imagine what it's like being on your side of the fence with your staff. How are they holding up?
Well, we try to help each other in, mental wise, just to make sure that they have the spirit. We rotate people to other sites to give them a break of doing every day here. In the current location, Manila is really hectic. It would burn you out if you stay here for long. And so we try to rotate, give people breaks, but like I said, it's tough, but I have to say that all the staff and all the clinic, all the tier 2 and tier 3 clinic, they are standing up. And I tell you, I know they get burned out, especially SDA and FHB. I feel for our colleagues, because they still see patients outside just to keep their clinic clean inside. So it is very hard to do. I would lose a lot of weight.
Doc, everything you're describing, it really does sound a little scary, with the people rushing to the clinics, and we're hearing about, we got to create this strike force, and the governor testing positive, so many cases every day coming out positive, and we're in PCOR 3. At what point do we say, you know what, we got to go back to PCOR 2?
We have several guidelines there that to go back to PCOR 2 is, I think one of them is a rate of positive that coming up, the hospitalization, the number of tests that we can do per day. Okay, so there's a guideline there to see if we need to go back to PCOR 2. So far, those guidelines we still meet. So unless we have a problem with testing, we have a problem in the hospital, that's the two biggest thing that we're looking for. But right now, we're not going back to PCOR 2 unless we pass this guideline. We just need to kind of put some new restriction out there.
Right.
I think people understand. I think the majority of my patients, when I see them, I ask them, do you mind if the government do that? And they all say no, they don't mind at all. We need to control this thing. So the majority of people understand we have to do what we have to do. Yeah. So I think the people of Guam is wonderful, understand and follow instruction, unlike the state side. So again, thank you everyone in Guam for doing their part.
Yeah, but it kind of sounds like, though, we're doing, like, let's do the PCOR 2 restrictions, but keep us in PCOR 3,
right? So
we can just still stay open.
Yeah, and then also I wanted to ask about this formula. Is this a formula that we got from maybe the CDC, or did we? God, I don't want to say, did we just make it up?
There's no CDC formula, Chris Sabrina. The formula we use is basically we try to make sure that Guam is somewhat much safe for anywhere in the stateside at this point. So the formula we come up is that, if anyone that can fall below our safety at this point, they are considered somewhat safe. Okay, but even at the rate of that we go up right now, we still consider way more safer than the state side. So the formula, that's what it means, is that it's not magical. It's not a guideline for everyone. We adjust it, but the key, the formula is keep the people that come into our island, wherever location is, that location have to be safer than our location. That makes sense?
We're safer, but we're slipping.
Yeah.
Well, we're slipping, and we're clamping it down, guys. We are. We see that people use certain loophole that we have, like declare their original location differently by change the flight path and all that kind of stuff. People are creating, and that's a loophole that we learn as we go, and we close those loophole as we identify them. And it's sad that people do that, but they put their relative and their family at stake and the whole island at stake by trying to go around the system.
Right, but some people, they probably see these horror stories about staying in government quarantine, and they're trying to, like, we got to find a way where we don't have to go to that nightmare. And have those issues been addressed?
Yeah, I tell you, for very few cases that you hear about the quarantine, there's so many cases that people appreciate that so much. We tend to kind of focus on any type of negative things on the Q factor. But in reality, if you do the survey in the Q factor, most people really appreciate the Q factor. It's not a five-star hotel, but they realize, it's basic, but it's a safer to the island. And I tell you, overall majority will not object to Q factor because they know it's a safety.
I think, Doc, that's where we kind of lose each other, is that people accept that they have to go into quarantine, but what they're not accepting is that it's substandard conditions, the cleanliness, the attentiveness to detail. I mean, we had an old man who couldn't get his meals with his medication, and it was just a problem. And so if there are these people who are enjoying quarantine, where are they at? Where are they at? So I get what you're saying, Doc. People, I support the idea of quarantine because we have caught the cases, but we got to do better in terms of basic stuff like cleaning the place, disinfecting it, making sure that we have the staff to take care of a lot of these people's needs, because a lot of them are coming from medical stuff. They came, like this gentleman came from open heart surgery, and it just broke my heart.
We agree with that, and those are the list that we look at, guys, that if you have a special condition like that we're going to make an exception and let you quarantine at home. And we are looking at those case by case, and not try to keep those high risk patients in the Q factor, and try to get home with early testing for them. And it's just not perfect, and they try to improve every day. But I say it's the majority of people do appreciate the Q factor. It's very basic stuff in there, but there's nothing fancy for 1 week.
Doc, before we let you go, thank you so much for your time. 3 p.m. today, there's a special Board of Education meeting to address what, if any, delay or any measures or anything with the reopening of schools. Just from the Physicians Advisory Group perspective, what are your thoughts on reopening the schools as scheduled, considering this surge that we're currently in?
We expect that doesn't matter how good the prep you put in place, there's going to be some falling out somewhere. And we expect that they might have a surge or two on certain school, but they have stepped there to identify and kind of not repeat what Father Dwayne is doing the first time. That's a lesson learned for everybody. But again, all the school masks are mandatory. It's not an optional unless you have very special condition that you cannot wear a mask, but it's mandatory. So I think the teacher and the student are comfortable unless someone breaks the protocol somewhere. But I think they need to go back to school. Because I think distance learning from online is not the best of them all. But at this point, we're going to try our best to see if the school can go forward. So we see, they have a lot of steps in online right now. So I know most of the private school, Catholic school are back, and so far, but this week there's no king except FD for now. But I think they fixed that problem already.
Okay.
Yeah, they started back today.
Yeah. Doc,
Yes,
thank you. Anything in closing that you want to tell the people of Guam before we let you go?
You know, I think everyone again, wear your mask. Wash your hand, keep the social distance. If you walk in somewhere that people have no mask on, either you have a choice to walk out or you tell people, or keep your mask on. That's the only way that you can prevent and help us in Guam and kind of get the number to go down. So again, don't let your guard down. We'll have to work together. Okay.
Right.
Thank you, Doc.
Thanks, Doc.
You're welcome. Have a good day, guys.
Wash
You
your
too.
hands.
Stay safe.
Wash your thumbs. Okay.
Thank you.
Let's see. Dr. Hoa Nguyen. Yeah, he's right. I've been going around doing a lot of stuff outside, and so have a lot of other people. And we don't wear a mask when we're outside. I hiked up Aston Ridge, and there's a super skinny trail. And the people were coming down, and it was like, I mean, in my mind, I was like, in their mind, they were just like, la-di-da-di, And so I actually just had to turn away and, like, face into the jungle.